or just feel comfortable. So you can also unmute, sorry, you can also turn on your video if you feel comfortable with it. Yes, your camera rather. So life after trauma, small steps that help trauma feel less heavy. So that's what we want to talk about. Small steps help feel that help trauma feel less heavy. Yes, I mean trauma could feel so heavy for people who have experienced it. I mean, really talking about those who are here for their personal mental health and oh, they've experienced trauma before, and I mean they can really talk about how heavy it can be. So, what are the small steps that make it feel lighter or less heavy? And that would be some of the, I mean, our main center of discussion today. So, Mr. Abdusalam, are you
Yes, I
on?
hope you can hear me.
Okay, sir, we can hear you.
Okay, good.
Yes. Okay, just hold on. So I just want to be sure you are inside. So, Mr. Daudo Abdusalam is a clinical psychologist, licensed, and a mental health advocate. I mean, maybe some of you have met him before. I don't know, but I mean, it's quite popular when it comes to discussion around trauma, as I mean, he has good clinical experiences. So from his profile here, the licensed clinical psychologist and mental health advocate, working primarily as a counselor at the Nigerian Armed Forces Resettlement Center in Oshodi, Lagos, Nigeria. He has a Bachelor of Science degree in psychology and a Master's of Science in clinical psychology, both from the prestigious University of Lagos. It focuses on managing various mental health issues, including mood disorders, trauma, stress, and substance use disorders. He's known for his compassionate approach, providing a supportive environment for clients to discuss their concerns. Additionally, he engages in writing and sharing insights on psychological topics and mental health advocacy. So he's a registered member, I mean, full member of Nigerian Association of Clinical Psychologists, International Society for Substance Use Professionals. Yes, I mean, he's a registered full member of the Nigerian Association of Clinical Psychologists. So, I mean, help me welcome Mr. Daudo Abdusalam Adeyemi. So, I mean, you can use your emojis, use the chat box to welcome him if you feel excited to have him here. And from this profile, you know that, oh, I mean, thank you. I can see Mr. Joshua. So, I mean, from his profile, you can know that, oh, I brought in someone who is competent enough to do justice to this topic, and you're going to be getting some real-time free, um, should I say intervention right now? Not intervention, it sounds like it, but I mean, real-time tips that will make trauma feel less heavy. So, Mr. Abdusalam, welcome, sir. You can mute yourself, sir.
Oh,
Hello, Mr.
sorry.
If you
Can you
can
hear
hear
me
me.
now?
Oh, yes.
Oh,
Yes.
beautiful.
Yes. How
So,
are you, sir?
very fine. Thank you.
Yes. I mean,
Nice to be here with you.
yes, so, I mean, glad to have you here on the show.
I'm glad to
So,
be a
I
part
mean,
of it.
yes, on the very day when you accepted to join me on the show. I was like, I was very glad knowing that people will get the best. So, and thank you once more for coming up on board.
Thank you.
Yes. So let's go straight to the point without wasting so much of our time. So, when we say trauma, many people think only extreme events. Yes, extreme events. From psychological perspectives, how would how would you help us understand trauma in a way that applies to many life experiences?
Okay. Thank you, Mr. Deonju, for bringing up this wonderful presentation. Can you hear me?
Yes, I can. I think others too can.
Hello?
I can hear you.
Okay, fine. So, again, thank you for bringing this up. And I also would like to appreciate the participants too for, making time for the show. So, trauma, of course, like you said, uh, many people, when they hear of trauma, they think of the most difficult of experiences. They think of the most extreme of life events. However, I would like to briefly introduce us into trauma from its origin, the origin of it being a wound. Trauma is basically a wound. Now, if we look at it from the wound that happens to a person, the body, the wound of the body, it doesn't matter how big or how huge the wound is, as long as there is pain, it is a wound. Isn't that correct?
Very correct. Very correct.
So it means that if you now look at it from the psychological perspective, the psychotrauma aspect of it, means we are saying trauma is a wound to the psyche, a wound to the mind. So it would not matter how big the event or the traumatic event is, it would only matter what it does to the individual. Now, trauma is that experience that overwhelms a person's ability to cope. Whenever anything happens and an individual feels unsafe or helpless, that person is facing a traumatic experience. Yes, we have, textbook descriptions of what trauma should be like. Do you get? Of course, either an actual death, a threatened death, being involved in accident, being informed of someone, especially a close one's involvement in traumatic experience, armed robbery, name it. There is one that is quite sensitive, and I also want to talk about it, in a sensitive manner, and that is rape, sexual violence. That is also trauma. Do you understand? So now, when people experience this, as long as the individual feels, you know, threatening in their day-to-day living, then a trauma had occurred. Okay? So again, I have said that what an individual experiences doesn't have to be quantified. It is not how huge or how difficult the experience is, but how the individual feels about it.
Yeah. So
This reminds me.
okay.
Oh, okay.
Okay. Right. Yeah.
Uh,
So that point. That's it. Well, to be sincere, if we look at our society, you hear
mm,
them say, "Oh, is it just that small thing? Is it just that small thing?" They quantify
exactly.
it. It's very common. And if you look at social media today, how they criticize, is it just that small thing? After all, I
Exactly.
went through it
So,
too, right? They quantify,
so
they
people
compare, but
exactly.
like you said, it is not. how big it is, right?
Mm-mm,
But what it does to that individual.
mm-mm. So people tend to minimize the experience of others, especially when they are not the direct victims. Okay,
Mm,
when they are not exactly the direct recipient of whatever the traumatic experience is, they tend to, let me use the local language, it tends to commonize it. Meanwhile, it doesn't go that way. Now, I was going to share with you an experience, a clinical experience I had some years back. The, the, there was this woman, I mean, a middle-aged woman at the time, and the case was that of burglary. There was armed robbery in a neighborhood, and you know, people were attacked, but our own house was not. The only thing that happened in our own case was that one of the robbers or the burglars scaled through our fence and took our phone through the window of our bedroom. According to her, the phone was on the bed close to the window. Do you know that weeks later, this woman could not sleep on the bed any longer
wow.
because it was traumatic enough for her? As if that was
Interesting.
not enough, she, vacated that room. She could not sleep there again.
Mm,
It became a psychiatric issue when this woman could not afford to stay in that house again because she could not, you know, take herself through what had happened to her. Now, I mean, anybody, someone would just, so what is it? What I mean, it is even easy for people to query that, what about those that were even physically assaulted or attacked by the robbers?
mhm.
But we say that people process chaotic or traumatic experiences differently
Yeah.
because of it could be because of the type of the trauma itself. It could be because of the biological makeup of an individual. It could even be because of the kind of support that people are exposed to, especially from childhood.
Mm.
All these things would come together to define how individuals react or respond to whatever traumatic experience that they have. So the point here, anyway, is that trauma doesn't have to be huge. The event doesn't have to be big. As long as it makes a person unsafe and it threatens their, living, then we need to be watchful.
Yeah, thank you, Mr. Abdusalam. And, I mean, this point is very vital for those who are here to help others, and even for those, I mean, for yourself as an individual, if you're here for your personal mental health, because you might be wondering that, oh, I mean, but truly it's actually small, right? So, and just take note, it's not how small it is, but it is what it actually does to you. Yeah. So thank you once again. Okay.
Just very quickly, you
Yeah.
know, trauma does not even have to be that an individual is the primary victim. It doesn't have to be that I am the one that
Mm.
experienced trauma. It could be indirect as well. It may
Wow.
even be that I witnessed the trauma, like I witnessed it happening.
Mm.
Right? People develop post-traumatic distress only because they have witnessed something happening. They may even feel bad for not being able to do anything while the trauma was happening. And it could even be indirect in such that you hear that something happened, and so it becomes
Yeah. So I think I agree.
it's
Before,
actually
I
quite
mean,
dynamic.
yes, I agree to that. Before I became a clinical psychologist, I mean, many years ago, even when I was much younger, I I saw how an individual was responding. I was quite shocked at it. And as at that time, the individual told me what happened. It means she was not even the direct victim of what happened. She just heard. So,
Mm-hmm,
I mean, and that affected her indirectly. So, I mean,
mm-hmm.
yes, it will come in different form. So, if I think now we can just talk about some of the emotional or behavioral changes that often happen when people experience trauma. So I mean, I'm sure it could be different for different people. So, but I mean, just from your clinical experiences, you could tell us some of the emotional or behavioral changes that people with or who have experienced trauma often face.
Yeah. Okay, so you see, we should start even addressing it by, in the face of trauma, how do people react, right? When people even when people are, you know, experiencing what is to be described as a traumatic event, how do they react? Because people need to know that the response to trauma, of course, is different. People will react to it, in different formats, and then it is almost involuntary. That is, you don't specifically have a vivid control of how you react at that point in time. So depending on what the traumatic event is, you may see an individual just freeze when something is happening to them. In Lagos here, what is something that is very common is all this theft. I don't know, they have a name they call it, one chance or something. That some boys will just commit you,
Mm-hmm.
harass you on the way, take possession of take charge of whatever possessions you have, your phone, your laptop, even your money.
Mm-hmm.
Some of them will do it indirectly. That is, they engage you and somehow cut away with your belongings, while some will be so direct, you see them that they are ready to attack. At that point in time, that is a traumatic event. And the reaction of the individual may be that they just go numb. You just see that someone who could ordinarily handle three hefty men and fight them, but in the face of that trauma, all he did was just to hand over those items to them. It's not
Mm.
stupid. It's not stupid. That is the reaction of his nervous system, of his brain, of the whole of him at that point in time. Now, following these traumatic events, don't forget there is something I said is quite sensitive, and I would just want to be referring to it. One, are you there? Hello? Hello? Oh, okay. I'm not sure. Okay, thank you. I couldn't hear the facilitator. So I'm saying that following this trauma, if we have understood how people are likely to react in the face of the trauma, of the traumatic event, days or weeks after, different reactions from different individuals. For some, I want to establish here that not everybody uh, would have difficulties following a traumatic event. Not everyone that has been a victim of a traumatic event would have any peculiar psychological difficulty following it, because in our makeup as human beings, there is what psychology call innate resilience. Some persons have the ability to process, whatever traumatic event that happens to them, such that life goes on almost instantly after the event,
Yeah.
right? While others would find it difficult to process the experience and they are stuck in it. So, one of the things that you may see, that you may begin to notice as changes in you as an individual or in others that have experienced a traumatic event, is that they have vivid recollection or the experience of what happens to them. Even when, I mean, it is not as though the thing is recurring, it is not happening again, but their memory, the memory is bringing it back to them as flashbacks. Some of them may even have nightmares. They have dreams of it, as
Mm-hmm.
though you see them waking up in terror, with fear, some sweating, some, having difficulty breathing, right? Just because a fragment of the traumatic event that they had experienced is coming back to them. Okay, then this is now the point where emotions begin to change. Irritability sets in. People begin to be angry. Provocation is a problem. Any slight test, in fact, there is also avoidance. Avoidance in the sense that people don't want to be reminded of that experience. Not only it's not even that they don't want they don't want it to be mentioned to them. They do not want to see any cue that could remind them of this experience. I remember having a doctor, although this doctor is also a soldier, a military personnel, and he had been to combat. Some of the examples you see me give be combat related because I work with the military. So this man had been to combat and he had seen a lot. And he was trained as a doctor to deal with wounds, deal with blood and that. But because of what was attached to his own experience, he could not bear to see blood again because seeing blood reminds him of his experience in combat. So people try to avoid things that could, remind them of what had happened to them. And this is where you now see if this is the case that you are witnessing or you are observing these traumatic behaviors in people, this is where you see that people are withdrawing. You may see that your colleague who is always jovial with you in the office is always up and doing, frequently causing sick, is absent arbitrarily, is not is even coming to work late. They may come to work late because perhaps on their way there was an accident one day and they had to go and take another route because they are trying to avoid the exact route that puts them
Wow.
into
Okay, yeah.
survival tips that behavior that people begin to they become restless too. I'd like to mention that someone who is having difficulty following a traumatic experience will be quite restless. They are not able to relax. They are not able to sit still, and they are hypervigilance. They are depending on the form of the trauma. Any small thing can quickly get this person hyperactive. People who had accident or well again I told you about being someone in the military. I've seen a soldier whose traumatic event became so serious that even the cutting in his house was a problem to him.
Wow.
The cutting flown like this, fan flew the cutting, and he was already battle ready.
Wow.
He had already taken shade, he had taken form as though he was in combat. That is the hypervigilance. And you also see that in survivors of sexual assault. When they see a man that has one figure, one physical characteristics of the person that assaulted them, they become hyper.
Wow.
And
Okay, yeah.
people who have
Yeah.
experienced it know.
Yeah. So, while knowing that some of these things, like you mentioned, some of our responses to traumatic events are usually involuntarily. That is, we really don't have so much control over them. Yes, like you said, someone who might be capable of, handling the issue might just respond by freezing. So, yes. And talking about the cutting, the military man who is battle ready just because of the way the cutting flies, it's quite, though someone who really don't know what trauma is, you feel you're battle ready just because of how the curtain is flying.
Exactly.
Our life experiences can, differs, and how we experience trauma differs. And thank you for the behavioral science you also mentioned. But I want to ask, or will I say, you need to tell us why it is important, I mean, to understand that all of these um, abnormal responses or all of these responses are normal
Mhm.
for abnormal experiences. Yeah. I don't know if you get that question. Why
I
are
like
these
the way
responses normal for
I like the way you
abnormal
were able
experiences?
to quickly, twist the way the question was going to sound. So the responses are normal, okay?
Yeah.
The responses are normal. What they experienced, what led to the responses was the abnormal experience because
Mm-hmm.
nobody wants to be involved in an accident that would claim their leg or their hands. Nobody
Mm-hmm.
wants to witness their colleagues dying. Nobody
Yeah.
wants to give their properties to
Mm-hmm.
people who do not want what who are not worth it. And I mean, nobody wants to lose their dignity to one riffraff.
Mm-hmm.
Do you understand? Nobody planned it. So these were abnormal occurrences. However, whatever reaction that a person gives to them, either irritability, as we have mentioned, either being numb, either withdrawal, either hypervigilance, these are normal reactions. Put it out there. They are not weaknesses, like
Mm-hmm.
some victims of trauma would put it, or survivors of trauma in this case would put it. They may think that experiencing, expressing those responses means they are weak. No, you are not weak. You are not weak. Because, look, like I said earlier on, the brain, the way the brain works, the brain usually, and of course, its optimum responsibility or function is protection.
Yeah.
So whatever response that comes either in the face of the trauma or following the trauma is the way of the brain protecting that individual.
Mm-hmm.
So meaning if a person chooses to withdraw following a traumatic experience, it is for protection.
Yeah.
It is for protection. Because I
Oh.
know that I was passing through this route the other day and area boys stopped me. They took my gadgets. If I chose not to pass through that route again, or even not even go out completely, that is because I don't want a recurrence of what happened. So, meaning my withdrawal, the brain is just telling me that no, you don't have to, go through this again. If you see a person who is hyper vigilant or hyper alert following a traumatic experience, what is he doing? What do you think he is doing? He's scanning for danger. The
Yeah.
brain is getting him prepared just in case there is something else coming up.
Yeah.
Are we going to call this weakness? Are we going to say this sort of reaction is abnormal?
Mm-hmm.
No. So the only thing is that some of these reactions or responses following trauma may now impede functioning, and that is where you know
Okay.
lecturer or show wants to address. So it doesn't mean. Are you with me?
Yeah. Yeah. Yeah.
Okay, fine. It doesn't mean that a person who who finds it difficult to live their life or do things the way they used to do it following trauma is less of a human. No, they are only trying to survive.
Yes. So, I mean, it means it's a normal response. I mean, those responses are normal.
Yes, because it's more from the brain.
Yeah. Yeah. So, I
It's a
mean,
natural way of protection for the individual who had undergone a traumatic experience.
yes. I mean, that makes a lot of sense, knowing that, I mean, I've had a bad experience year before. I mean, the brain naturally will want to protect you. So the first response is protection. It's either I avoid that place, I fly, I do just something that everything to make sure that what I experienced doesn't repeat itself.
Exactly.
Yeah. So I mean, that makes a lot of sense. But I mean, the next question I want to ask is I mean, the recent story of this lady is in Mirabel. I don't know if you heard about um, that experience, that lady who claimed to be raped. The- oh, I hope network hasn't.
I'm
Uh,
here. I'm
okay,
here.
good,
I'm
good,
here on
good.
two devices actually. So
Okay, yeah,
one is
that's okay,
frustrating,
sir.
the other is stable, I believe.
That's okay, sir. That's okay, sir. Thank you for that. Yeah. So, did you hear about that case, Mirabel? I mean,
Well, somehow, briefly, I'm
okay,
not in social media.
okay,
There's nobody
okay.
to me.
Yeah, so let me just brief you. Let me brief you so you will get my question. So I mean, yeah, so when she got up, although later it was debunked that she was raped, she later confessed to this social media influencer, very dark man, and so on. Yes, but while I was reading through people's comments at the first instance when she claimed she was raped, and someone commented that, oh, I'm sorry that you experienced it, but you can never heal from this experience. So, and she was like, no, the person was like, I mean, that is how he's been carrying his own trauma too, that she can never heal from it. She just have to manage it, right? So, but that gives me a kind of idea that this person must probably have been using logic all this while and end up saying, this is my cross, I'm going to carry it anyways. I mean, or I've been managing, coping with life with logic, right? And he has eventually seen that, I mean, there is no other way out of this. So, but I just want you
I
to
lost you
talk.
at a point in time.
Yes. Oh, can you hear me clearly now? Hello, sir.
Hello, I lost you at a point in time.
Okay, so can I be
But
heard now?
I can hear you clearly now.
Okay, yeah, thank you. So, and the individual was like, she cannot come out of it. I mean, she can't be ill. She just have to manage it and live through it like that for the rest of her life because he is also living his life with his trauma that way, right? I mean, then it gave me an idea that he's probably been using logic around it. Yes, just to I mean survive or cope, and he has accepted it as his cross. But I mean, I want to ask, so why doesn't logic alone help people to move on after trauma? Because from what he was saying, he has used logic, and that is how he's now living his life over time. He has accepted that I'm going to live my life with my trauma all through, and I mean, nothing will get better. From the way he put it, I can't remember the actual phrase anymore. But I mean, do you think logic alone can help people move on after trauma? And why will logic alone not help people move on after trauma?
Okay. Um, like I have established earlier on, the responses to traumatic experience is multifaceted, and no two individuals, usually would experience it the same way.
Mm-hmm.
Do you understand? So,
Yeah.
and when you when people try to just use who they are as individual to judge what a response to trauma should be like, then we say that is, considerably maladaptive. Because, first of all, trauma is not just a memory. Being a
Mm-hmm.
victim of trauma is not just something you have in your memories. It's also in the body,
Mm-hmm.
right? While the brain is processing the experience, the body is also reacting.
Mm-hmm.
I have seen someone who still shivers 12 years after his traumatic experience. He nearly had what is this? when aircraft, when it crashes, okay? His own
Okay.
aircraft nearly crashed. It did not crash, but something like that nearly happened. And this
Mhm.
person, 12 years down the line, still shouts. I mean, the experience or what happened to him was not just in his brain, but also, stored in his body. Now, it may be correct somehow to say that, are you
Yes, I'm with you.
say that the memories or the true picture of the event does not erase from
Mm.
the victim's mind. That may be correct. Okay.
Mhm. Yeah.
So it may be difficult to forget such, experience. But what we are saying is that following this traumatic event, people can still learn to live a productive life.
Oh, great. That
Do
gives
you
hope.
understand?
Mm-hmm.
So while the memories would be there, I mean, it becomes a progress when the person is able to live through the memory productively.
Mm.
Do not forget
Mm.
that it becomes a problem, it becomes a psychological thing when the person remembers and does not want to relate to people again, when the person remembers and the body is down. But we are saying that
Hello, sir.
progress or
Okay.
healing is such that you may even be able to go through Nigeria. Sorry, Nigeria, Nigerians. Can you still hear me?
Yes, I can. I
Oh,
can.
okay, okay. So I'm trying to establish the fact that healing specifically means that the individual, the survivor of the traumatic event, is able to, one, recollect what had happened to them without, you
Mm-hmm.
know, going down for it, without
Okay.
having so much of mental breakdown as they used to have when that thing happened or in weeks, months, or years following it. So healing after trauma is actually possible. Very, very possible. It's just that
Yeah.
it's a process. It may be slow. Do you understand?
Mm-hmm.
It may be
Yes.
slow. It is not spontaneous, nor is it instantaneous,
Yeah.
right? Because we have to understand that the brain learns the protective behaviors that it is giving out, even though we now know that those behaviors are affecting functioning. So to restore functioning, the individual would need to have the brain unlearn some of these behaviors and relearn others. This, like I said, would take time. This, like I said, would take process. This, like I said, would take commitment. But people, of course, I mean, we've had them, lots, in fact, lots and lots of them who have not only just recovered from, their post-traumatic distress, but are functioning well.
Okay.
So the
Yeah.
individual that raised the comment, I don't know what he exactly meant by he living through his trauma. He himself might have actually healed in a form
Mm-hmm.
of toxic. If he's a male, I would say toxic masculinity nature.
Mm-hmm.
What he might have been doing was that he's repressing the emotions. So to ensure he's functioning, he might have ensured that he's trying to not in any way remember it. He may be forcing himself to be functioning so that he won't even have time to process the event.
Oh.
I've had
Mm.
someone who lost a close relative, and 2 days after, he's back at work. So people
Hmm.
sent him to me. They sent him to me that this person needs help. He needs brief counseling. He just lost, and they are surprised. His superiors were surprised to see him at work. So when he came,
Hmm.
he was smiling. He was, doing everything as though nothing happened. But his affect, the look on his face, would
Hmm.
tell you everything you need to know that this person is just a tickle away from exploding. So when I provided
Hmm.
him the room, the avenue, he first cried.
Hmm.
What was he doing? He was only masking
Hmm.
his difficulties to the person like me be down because someone died. I can still function. That is the logic that does not oftentimes work.
Oh, hmm. I mean, thank you for that. I mean, that's really, I mean, that makes sense and was in fact insightful. I mean, sometimes the logic does not work. The fact that you try to repress it, probably like taking that man's example, I mean, going to work when he hasn't, I mean, he hasn't even gotten his balance. He hasn't even, I would say 2 days, he hasn't even processed the information well. I mean, so
He hasn't even known what happens to him.
honestly. So, and but the logic was if I go to work, if I mix with people, I'll forget about it, I'll repress and so on. Right. So I mean it thought I mean that way really work. Yes. So yes, your questions can start coming in. You can put them on the chat box. Thank you. I think someone wanted to
Yeah, I
ask.
saw that too.
Yes, you can put it on the chat box. And if you feel you prefer to, I mean, to say it, just raise your hand. I would see
And
that.
yes, yes,
And
yes.
yeah, that's fine. So, at, in fact, you've really said a lot. And another thing you mentioned, which we must know, you mentioned time. You mentioned process. I mean, there are processes to these things. So,
That's
time
correct.
process and commitment.
Yes,
Yeah, so I mean, I know that. So it doesn't you one doesn't just heal spontaneously like that. It doesn't just happen. It takes time. It takes you following the process. I mean, enduring the process and being committed to the process.
that's
Yes,
correct.
yes. So although the should I say we just want to hit the nail on its head, like people of my culture says. Yes, you want to hit the nail on the head,
Yes,
right?
correct.
Yeah. So, okay. So should we? I think let's do. Okay, let the question come in. So, and as time goes
The
on,
questions are here, we can attend to them. If not yet, we can keep up with whatever it is you have on your schedule.
yeah. Okay. So, I mean, someone asks a question. Can trauma be dormant? Can trauma be dormant? I don't know if you see that on the chat box.
Can what?
Trauma be dormant?
Can trauma be dormant?
Or do you want the person to put it in context? I mean, let's understand what it meant by
That may be better.
dormant. Yes. Or you want to give an example? Please, do you want to put it in context, Mr. I think Abdul Gafar? So probably he wants to type it. You can type it so that, I mean, when he's answering the
While we wait
question,
for him, while
yeah,
we wait for him, we
yeah,
can quickly benefit ourselves with, if we are talking about it takes a process, what are these processes?
yeah.
Do you understand? So what do people really need to do to, especially as small traceable steps to get out of their traumatic life? Do you understand?
Okay. Yes.
One, Okay, I will attend to what Mr. Abdulgafar wants, but let me quickly put this in perspective. I can say one or two, then briefly go to what is asking. Do you understand?
Yes,
All
please.
right. So, first of all, when a person is a victim or a survivor of trauma and the aftermath is disturbing, they are having post-traumatic distresses. It is not healing would not come from analysis.
Mm.
When I mean healing would not come from analysis, I'm saying that analyzing the the trauma, talking about what they did for the traumatic event to happen, or what they did not do, what they should have done, or it would not help
Mm.
anything. What that would only lead to is, guilt
Yeah.
and shame.
Yeah.
Mhm. And of course, blame, especially if the trauma, if the traumatic event is a form of betrayal, perhaps from trusted individuals or people in higher authority. So you
Mm.
would realize that analyzing a traumatic event would only, bring the mind down the more. So what a person should rather do uh, is to take action, to start regulating their emotions, the kind of emotional and behavioral responses that they give to this traumatic event instead of wanting to find out the causes or their, the things they had done in the face of the trauma. And one very uh, active step is slow paced breathing.
Mm. Okay, but I think before we come to these steps, I mean, yes, a lot of people benefit from these steps. So before we come to these steps, you mentioned that in fact that was what we want to go into. So we can just quickly take Abdul Gaffar's question and um Bella's questions, and from there we write on to the step. Bella's one is on complex post-traumatic stress disorder. So, and
Okay.
okay, but let's take up the Gafals first.
He said, can trauma be dormant? That is, can it be forgotten and activate again? Oh, okay. So usually when you say it is forgotten, hmm, what you are only saying is that it is latent. That is, it is stored somewhere, somewhere deep in the memory where you are not actively processing it. Do not
Mm,
forget that earlier on, I talked about people repressing their emotions.
mm-hmm,
Do you understand? So, in the process of repressing emotions, especially someone who doesn't want to think about what had happened to him, someone who has, withdrawn from the face of the traumatic event, can push the recurrence or the memories of the experience into uh, into a latent state, whereby it may now be rejuvenated or reactivated later in future when something similar comes up again. Meanwhile, there is something we need to note which is very important. Anytime we repress unfavorable feelings or emotions, or there is a way it imprints on our behaviors. We just may not know it.
mm-hmm,
Hmm? We just may not know it. So I would want to marry this this point of my explanation to the person that asked about complex post-traumatic disorder, complex PTSD. So, see, I talked, the only reason why you would talk about PTSD, post-traumatic stress disorder, is that a person had experienced a traumatic event, either directly or indirectly, as we had described it earlier. Either they witnessed it or it happened to someone that they know. Now, complex PTSD is usually a form of multiple traumatic events that occurred. It's more longitudinal. It occurred over a long period of time, especially when it is from uh, uh, a place of primary care given or trusted relationships. For instance, a child that was neglected or abused might end up developing complex PTSD. And what you would see is that they would have difficulty in adulthood. Now, the difficulty they're having in adulthood is not, solely because of their adulthood experiences, but what they had experienced growing up. I'll give so a boy, for instance, whose mother was nowhere to be found growing up, may have a problem in establishing intergender relationship, maybe having a romantic relationship or something. That is because that level of attachment that they were meant to grow up with was not there. Or a person that was abused, either physically or sexually, growing up. As a child, when they grow up, they may, because it is not all of them, so I won't say they will, but they may have difficulties dealing with life events. In fact, some of them may become victim of abuse again as adults. Some of them may be stuck in chaotic or abusive relationships, especially as ladies, because of their experience while growing up. So, in fact, it is just as the name appears, complex. And, well, usually for people with complex trauma, they always require professional help to get out of it. I think we are having a number of questions now. Can you please
Yes.
lead me to the
Okay,
order?
yes. So here is it. Here is it. Before we take some of the other questions, I think we have two more on ground. So let's just talk about some of the small steps and we break it in with questions again and we ride on from there. So let's talk about, of course, we've known that trauma can feel overwhelming. Can feel overwhelming. So, and we just want to know what are that or those small steps that can let trauma feels like it is nothing or feels like it's less heavy. Not nothing per se, but
Yeah.
less heavy. Yeah.
Yes. Thank you. Of course, I like how careful you are in choosing your expressions. The small steps, the small psychosocial steps would not trivialize trauma, but it would, hit it where it is hard and, make it soft. Meaning those emotions, those memories that are disturbing, that is making life difficult for those experiencing them, would become things that they can, walk through or work with. So one of those things that people need to imbibe is the culture of small paced breathing. I was going to jump into that earlier on. I it's aside from it being a personal practice, it is something that has been quite helpful in clinical practice. Sometimes when you tell people that I'll take you through relaxation, and the first I want you to do, or that I believe would be so helpful to you is deep breathing. We'll be like, deep breathing here. Nobody say that we do. So, but we let them know that it is different, right? So, small paced breathing, whereby you're breathing deeply, you feel the tension that comes with holding your breath for 4 to 5 seconds. Then you breathe out gently, 4 to 5 seconds or a little longer, up to 7 seconds. Then you pay attention to the relief that comes with, releasing the breath. Doing this 5, 10, 20 times as much as is possible would help deal with the emotions. It would help deal with the intrusive thoughts that comes in. Then there is something we call grounding. Are you with me?
Yes, grounding.
Grounding, I may not have all the time to explain what it means, but grounding wants you to be mindful of who you are and where you are at a particular time. So when
Can you
the
come again?
memories
Who
of
you
traumatic
are
events,
and
where you are
okay,
at a particular
okay.
time,
So yeah, you can write on, sir.
traumatic, the memories, right? The recollections of traumatic event becomes disturbing. Grounding may be your best bet. What do? You use your sense organs to pay attention to things around you. We also call it mindful motions. Okay, so usually it is that this technique is they call it 5, 4, 3, 2, 1
Yeah.
techniques. Unfortunately, I'm not so sure we have the time, but you can say, okay, think of 5 things that you can see in your environment. That
Mm-hmm.
way, you are not just looking at it, you are mindful of it. You are telling
Yeah.
yourself that I am here at this present time and I'm taking account of things that are around me. You look at it,
Mm-hmm.
I can see a fan, I can see a jotter, I can see a computer. Do you understand? You take
Yeah.
your time to smell, to feel, to hear.
Mm.
When I tell people about mindful motion, that is, you can even take a stroll, a gentle stroll, just from a distance to another. But you are not just moving, you are paying attention to your environment. You are paying attention to the things you hear. You are paying attention to how the air in the atmosphere, how it feels. You see, when you do this, you are detaching your mind from wandering around thinking about what had happened, thinking about the horrors. You are connecting your mind to your body,
Mm.
right? And of
Yeah.
course, that would declutter the mind a lot, and you would realize as individual that you are living a less heavy life. Okay? Then there is
Yeah.
something that is very important, and maybe that is where I will stop. That is safe connection.
Safe
Connect with
connection.
people. Yes, connect with people. That is where the idea of having safe support comes from. And so this is a form of public advocacy. People should please learn to be less biased and non-judgmental. The only reason a lot of persons grew up with their trauma that now become complex PTSD is because they could not talk about it. Why? Because they would be shamed, they would be judged, if not even beaten. I read a story yesterday. It was just coincidental. I wasn't exactly looking for a story, but I read a story of Iyabo. The story, she published it in 2021, I think, who spoke about being a victim of rape 5 different times. The first being when she was 14 years old. You know, if that woman had been given the opportunity to express herself, if she had been able to talk about that experience and the first time without being judged or being hurt, she might have been able to avoid the subsequent ones. She might have been able to avoid it because she might have learned from people, she might have gained experience, people might have, but she couldn't say it to anyone at 14. Imagine a 14-year-old. So safe connection is key here, whereby you look for people who you know would listen to you,
Yeah.
talk to people. Of course, this is also where talking to a therapist comes in, but I believe we are not there yet. We are not at the point of speaking to therapists yet. But people around you, friends, relatives, colleagues, those that you know share the same value with you, I will not judge you with who you are. Someone contacted me a day or two ago, wanted to talk about something, and she wrote, "Please don't judge me." I was like, when I'm not Madam Kekere, the chief judge. I didn't do law. I'm a psychologist. We don't judge here. We don't do that here. Tell me what
Mm-hmm.
it is. And I am trained to listen to you. I'm trained to
Mm-hmm.
provide an environment for you to say what it was or whatever it is that is bothering you. So if you are fortunate enough to see such individuals, it will make the burden less heavy. And it helps a lot. Talking to people around you helps a lot. Thank you.
Yes.
Oh,
Yes.
okay, so you wanted us to.
Yes. So yes, I wanted us to address some of these things, but just mention some points you've said. To bring it back to our should I say memory right now. So one, deep breathing. You mentioned deep breathing. Yes, I think I've
Yes.
experienced someone who was shocked when I mentioned deep breathing during some of the traumatic experiences. But it's proven, it's scientific, it works. So,
Definitely.
grinding, yes. Focusing on the here and now, yes. You, it brings your mind to the present, and you
Yes.
talk about, safe connection. So basically, if you can hold those three, these are things you can issue. It's within your reach. It's what you can do. Even if there are some additional professional intervention you might need, but at least these basic tips
Later.
that has been given to you, you can use it, right? You can use it, and it will make trauma feel less heavy. But remember, time. It could take time. It mentioned process and commitment. It is not one off. It is not one off, to be sincere.
It is not. Steady.
Yes, yes. And that safe connection matters. One of my questions would have been, why do people find it hard to request for help? After trauma. That would have been one of my questions. But you now mentioned the reason in between when someone said, do not criticize me. So, criticism is part of the reason why some people wouldn't speak up about trauma. But like you mentioned, safe connection. So, which is speaking to people who you know will listen to you. Yes, very important. Those steps should be, with us, we should hold it well and use it as much as we can. So, I think two questions we have left here is how can we ensure safe and not re-traumatized during recovery time? So this person is meaning that one could be traumatized again during recovery periods. So how can we ensure that we are safe? Do you want to say something about it, Mr. Abdul Salam?
Okay, yes. I appreciate Mr. Abdul Gafar for that, question. It is, I don't know the perspective he is coming from asking that question, but I also know that we have seen instances where uh, uh, all in the process of looking for help, people sink in deeper. Do you understand? So,
Yes.
if we look at what we have just said now, the steps, these three gentle and little steps that we had established earlier on, they are more like first aid for you as an individual to reduce the weight of the traumatic experience on yourself even before you seek external help. Okay,
Yeah.
that keeps you as safe as possible. Then again, it is important that individuals should, please, I'm begging now, learn to reduce self-blame. Self-blame is a one-way ticket to reactivating your trauma, even when you are recovering already. When people
Yeah.
blame themselves so much, especially for things they believe they had done wrong, or that things they believed they were supposed to have done, but they did not do. That is error of omission. I have already drafted in into moral injury. You just did not know it. Error
Yeah.
of omission or error of commission, where they believe that if I had not, some people may say, if I didn't go there, I wouldn't have been assaulted.
Yes. Yes.
While that may be
Yeah.
correct, that
Yeah.
event, that experience had passed. Somebody would
Yes.
say, if I did not travel, if I had not followed that route, I wouldn't have had this accident.
That's true. Are you in?
If I had not been speeding that much, there was something said to me to not engage accident, and he lost his limbs. I imagine the level of blame, self-blame that individual will be placing on himself. So people should learn to reduce self-blame. Then, please, this is very important. Although this is more of on we clinicians than the society itself. People should know who they go to for help. That is a core area where falling back into the trauma, even while trying to recover, may become a big deal. Because when you go to someone who probably is half trained or even not trained at all, maybe just did a course on operational, whatever, and give themselves the tag of a therapist, and then boom, there is a problem. Such individuals might, reactivate the traumatic experience of individuals. So while it is good and of course advisable that we seek help, we should also try and shine our eyes as to whom we, present our case to. Do we have another question there in
Yes.
the chat
I think
box?
yes. This is the last question we have. Yes. So let's quickly take it. I mean, we plan to just use an hour, but this 15 minutes past 7. So
Yeah.
let's quickly take this question so we can run off. So I mean, knowing the fact that, like I mentioned, we have some of our Muslim brothers and sisters who might want to, I mean, have something after their fast. So let's quickly round up with this. So the question says, okay, let me see. Yes, Belkis says, thanks for this beautiful opportunity. I personally appreciate. My question probably has nothing to do with trauma, but fear. This has to do with fear of hosting people or even visiting people. There is usually fear of uncertainty, experiencing unrest when there is need to go visit someone or welcoming someone. Sometimes I begin to wonder if this is actually normal. Note, sir, never been a victim of accident or kidnap, whatever. The fear is just there. So, sir, can you please comment about it? So, as she said, it's not more of trauma but fear. So, can you say one or two things about it?
Okay, of course. One of the responses or one of the aftermath of trauma is fear. PTSD is also fear-based. That is, I mean, if a person doesn't avoids a place where they had a traumatic experience, it's because they fear that the experience may recur.
Mm-hmm.
Do you understand? So
Yeah.
fear would as well be trauma related. However, this individual not been a direct victim of any traumatic event whatsoever. They have not been kidnapped nor, had any form of accident or so. But then the fear is there. One, so you see, being anxious about an upcoming event or something is normal.
Mm.
Do we understand?
Yeah.
Anxiety is not in and of itself a bad thing, right? It's
Yeah.
only when the fear is now uh, 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 out of proportion that is, big enough to affect functioning. That is when it becomes a problem. She said that when she wants to host people, she entertains fears, or when she's going to. I do not want to undermine her lived experience. I would say that the anxiety in that situation could be an adaptive way of getting prepared. If I want to have a visitor, I know that 2, 3, 4 persons are visiting me, and that is not the norm. They don't come to me all day, right? I will be psychologically preoccupied as to how do I entertain them to satisfaction. That can
Mm.
bring fear.
Yeah.
Okay. However, if this fear, as described by our honorable sister, is such that the fear is so much that she doesn't even want these people to come at all, or she's not willing or could not visit when she's meant to be the one, doing the visit to someone else, then this is the problem. And so this could just be a thing of generalized anxiety disorder, that you don't even have a reason for having this, disproportionate fear, but it is there. Now, what I say to you is that the things we have said above about, relaxation would surely be of help. Grounding, gentle motion, mindful motion, safe connection, talking about it to people. However, if this is recurrent, it's persistent, and it's affecting your interpersonal relationships with people, then you may actually seek help, whereby a clinician would sit with you and understand the core of this fear.
Yeah.
Do you get?
Yeah.
It may be, you may not know it, it may actually be a form of indirect trauma. It may be that you have witnessed a person, something horrible happens to a person in the face of these life events that you described, or someone close had to be the victim of such thing. Don't not forget that we talked about witnessing trauma or being told that something happened to a close relative.
Yes.
However,
Yes.
it is not I'm not. We are not mind readers. Let me put that out, right?
Yeah, yeah.
So we cannot know until we are able to assess the situation, right? So if this, as our sister described it, is, you know, impeding functioning, if it is affecting her day-to-day activities, then she should please reach out to either of us here or, elsewhere where help, professional help, is readily available to her. Thank you.
Yes. Yes, thank you. Yes, like I said, you may want to explore why is it. To be
Mm,
sincere, if you just look around you, you might not be able to figure it out. It can be, something as a result of what had happened, in the past, long ago and so on. So, working directly with a clinician might, you might be able to explore together and discover why it is like that and how to walk through it. So thank you very much, Mr. Abdusalam, and thank you all for your questions. Zoom, okay, I can see Kaka. Kaka said F. Maybe that's good, or oh, we are together and following. And Zoom user says it's very educational. So thank you very much. So we really appreciate us for coming on board, asking these questions. So we wouldn't, yes, thank you, Aisha. I can see, you appreciated us. Yes. So we wouldn't ride on with much questions at this point in time. Our time is fast spent. So, but I think I just have a few things to announce and we ride on from there. So once again, Bella, I can see you. You said thank you. Yes, we appreciate you. Thank you too. Yeah, so Mindwell Psychological and Wellness Service again. We'll be doing this monthly to make sure people get the right education, people get basic help. So you are aware and I mean, so you could do one or two things yourself. And if there is need to see a clinician, you will know after some basic psychoeducation that is being done here. So please, you can follow our social media pages for now. To be sincere, we are active on TikTok and soon we'll be active on platforms like Instagram and Facebook. So we know a lot of young people use TikTok and they are part of our targets, right? So, and that's why we're on TikTok first. You can follow our TikTok on Mindwell Psychology. Just look for it on TikTok. It will be sent to us. And when we are active on Instagram, as soon as the account is on, we are going to alert us to, as long as we've registered. Please, we beg you, please follow our pages and so you can get updates, probably help us reshare for people who might need it. So, and some of our services are written here. Psychological support, child and adult and developmental services, assessment and screening, group and community support, referral and collaboration, consultation services, training and resources. These are some of the things we do under our, clinic. So again, I think one more thing. Next month, what we'll be talking of or about is not trauma per se, right? So, but it's something related to personality, and I'm so sure you are going to enjoy the topic. Another resource person will be brought on board. So, and some other times, I know, if Mr. Abdul Salam is not so busy, he will come on board too some other times to address us or to address some core clinical issues that people will benefit from. So, but another well knowledgeable and experienced person a clinical psychologist as well, will be coming forth next month. Unfortunately, I don't have the flyer here, but please, if you have registered, you will get the updates via your mail, or if you are in our support group, you can get the updates in the support group. The support group is just for you to maybe get updates if there are resources, one or two things. I mean, you don't really, I mean, it's not compulsory you chat on the support group chat. I mean, it's not compulsory you share your personal experiences, but if you feel, oh, it would help someone, please go ahead to share, right? So, um, that is it. Please, we will not reach you personally for any form of, support and all of those things like behind the door. Any information will be passed through your email, and if you need to reach us, please reach us through our email address and the numbers there. Should you need to consult with us, or ask one or two things, you need assessment and so on, or psychotherapy, we are in. So we are ready to give our best so to support you, as we have a rich team of clinical psychologists that will work together. Zoom user, thank you once again. So I'll see you in your email, and you can reach us through these numbers. Once again, my name is Blessing Adeyanju, a clinical psychologist and a licensed behavior analyst. Thank you. Please, as soon as the flyer is out, when we share to you for the next event, please help us share. Please help us share. I mean, someone might need it. So thank you, and follow us. Mr. Japheth, thank you. Thank you. I think we are good. And for our Muslim brothers and sisters, Ramadan Kareem. So, Mr. Abdul Salam, I really appreciate the sacrifice this period. I mean, it's not easy for you to sacrifice
Yeah.
your time. Yes. So thank you, and God bless you. So our YouTube, we will put this on our YouTube page, and once it's out too, I'm going to send the link to Ross, so we can always rewatch, listen again, and we are good. Thank you, and have a beautiful night rest.